So we're here today to complete training at St. John's School to make this school the first Hartford Consensus compliant school in the country. So be the first school where every single teacher has had hands-on in-person training on hemorrhage control and tourniquet application, and where we've successfully distributed those hemorrhage control devices, tourniquets, into every classroom in the entire school.
Beginning of the year, David approached me as to how open we would be in learning this tourniquet or participating in the training for tourniquet use. And when he explained how this came about and the importance of this and the fact that many lives could have been saved at Sandy Hook, we felt an obligation to participate in this training. I feel that we would be negligent if we did not learn this technique.
Right now we're doing the training to be able to make sure that we can properly apply tourniquets during a crisis or any kind of disaster that we might have. I think it's really great for teachers to be able to just have the skills, especially because we're learning a lot about different safety procedures as far as like lockdown drills, making sure that we understand, if you see someone in the building who you're not familiar with, make sure that they know where the office is, just to be more cautious and aware of it, and that it's a really good skill to have in order to, prepare us for, God forbid, anything happens to any of our students.
Teachers fall under our new appreciation of what a first responder is. Generally, we regard first responders as police and fire and EMS, but a host of recent mass shootings has made us appreciate that we should probably redefine what that role is and what a first responder truly is. The fact is that at all of these mass shootings and mass casualty events, including the Boston bombing, truly the first people to respond to the injured are bystanders. And as was the case during the Sandy Hook catastrophe, those first responders, truly the people on the scene first, were the teachers. Doing this project itself is its own body of research. But within this educational process, we're also retesting people we educate throughout the year to determine how often lay people will need retraining to maintain their skill set. We try to teach them the correct sequence of steps to apply a tourniquet, and then teach them the pitfalls and the common errors that people make so they can consciously avoid them. Everyone passed, and I think everyone passed with a high degree of enthusiasm.